You're not crazy because the doctors can't figure out what's going on with you medically. I've personally experienced this, and I've seen many people in my own practice going through the same thing. Hi, my name is Michelle Adler. I'm a mental health therapist and a licensed professional counselor, and I'm making a series of videos to help decrease the stigma of mental health. So I'm going to keep on talking about it. I'm trying to put out a video every week. Last couple weeks I wasn't able to. I ended up having another round of kidney stones, which kind of brought me to this topic because I was going to do something else. And this one's a little bit more passionate right now. In this video, I'd like to talk about how to advocate for yourself when you have problems medically and the doctors aren't listening to you, or you feel like they're not getting to the issue. If you're confused, let me explain this. There's a small percentage of the population, it's about 10 to 15%, who don't fit the normal statistics or symptoms when we have medical problems. And this causes difficulty with the doctors understanding what's going on. And they misdiagnose us a lot. Or they give us mental health diagnoses, which is awesome. I can tell you from my own experience, about 8-9 years ago, I started to feel some pain in my abdomen in different areas, and they were very specific. So I showed the doctor, and they didn't really understand what was going on. They weren't sure. It wasn't consistent with anything they knew. So they diagnosed me with fibromyalgia. No testing, no labs. They just gave me that diagnosis. So fast forward about 4 or 5 months after that, I was on my honeymoon and I ended up in the ER because that's where you want to be then. They were concerned about the pain and they wanted me to stay overnight for observation. That was not going to happen. So I didn't go, or I didn't stay. Then I came home from my honeymoon, and a couple months later, I ended up very, very ill. I had trouble sleeping, I had trouble eating, and the pain was unimaginable, and I couldn't get through it. It was just awful. So I went to different doctors, because that's what you do, right? I make an appointment, go to the doctors. I went to all kinds of different specialists, all kinds of different places. I even traveled to see different doctors. One time I remember the pain was so bad, it took me almost an hour to get into the office from the car. It was really, really awful. And then the week before I was admitted to the hospital, I was in the ER 5 times in 1 week. The doctors yelled at me sometimes, they swore at me. They were frustrated because they didn't understand why I kept coming in. And I'm frustrated because I'm in a lot of pain and they're minimizing it. I had a doctor stare me down in the ER and tell me that there was nothing wrong with me, which is awesome. I also was asked if I was pain med seeking, but I wasn't asking for pain meds, so I'm not really sure how that works. I was accused of doctor shopping from going to different ERs. And honestly, I thought maybe somebody would have a different perspective. I felt like maybe I'd get lucky, and a doctor would have it figured out. So my husband and my mom went with me the last time that week that I went to the ER because we were tired of it. I could hardly eat. I wasn't sleeping. I was crying all the time. I was really scared. And we pleaded and begged with the ER doctor to admit me. Now, funny, because once I got admitted and they started to do the more expensive testing in the hospital, and they did quite a bit of testing, because I think they started to figure out that they may have messed up. They found out that my gallbladder was going bad. I didn't have stones, but my gallbladder itself wasn't working anymore. And I had lesions or cysts on my liver, and I had kidney stones in both kidneys at the same time. And the doctor said, statistically, this doesn't happen. I don't care because it's happening to me. So statistics doesn't matter anything to me right now. So I was in the hospital for a while, and when they took my gallbladder out, there was no structure left. My body had started to break down my gallbladder that wasn't working. If that explains how long it had gone on and how much pain I was in. I was extremely frustrated and angry that I had to go through all this. This is similar to what I'm hearing in my own practice. I'm getting lots of people that are having the same medical issues that I've had, and they're not getting any results. Usually rotating in and out of the ER because they're in a lot of pain. They're scared. They're afraid they might die. They're seeing a lot of doctors and specialists, anybody that may be able to help them. Doing research on our own through internet searches, medical journals, talking to people, our own experience. Maybe we've had medical problems in the past. Sometimes we get thrown out of doctors' offices and practices. That has happened to me as well. We're, like I said, accused of pain med seeking, and we're told that there's not anything possibly wrong. Our medical issues end up being minimized, and then the problem is later it takes longer for recovery and the treatments. And that's so frustrating because we've been screaming for help for so long. What also happens is that we're diagnosed with mental health issues, which is awesome because actually we're physically ill and they can't figure it out. So now we're mentally ill. The problem with this process is it ends up causing PTSD because it's its own form of trauma. Being invalidated over and over and over again is trauma. So great, now we are crazy. So looking into this, I think there's a lot of things that are going on. I know that they've had energy conferences where they've had doctors and psychiatrists and therapists and different practitioners come in to talk about why there's this 10 to 15% of the population that is not exhibiting the same symptoms of everybody else. They can't read them. They don't understand what's going on with them. And then these people are really ill in the end, but it takes so long to figure it out. Their symptoms are completely different. Their affect may be different. Their behavior may be different. Their labs aren't in the normal statistical range because most of medicine is based on statistics. So if you learn the statistics, you're good. But if you run into people outside of the statistical norm, that can be a problem because that's not what you've learned. Another issue is that doctors only listen about the first 30 seconds. And I don't know about you, but when I have something going on, it's been going on for a while, I have a lot more to say and it takes me a lot longer to explain it. But sometimes they don't listen. There are stereotypes between men and women that do come into play here. Witness this when I go into the ER for a car accident versus my husband. When I go into the ER for a car accident, I usually don't have any testing done. They usually kind of pat me on the back and kind of soothe me and tell me that I'm fine and to go home. My husband gets x-rays, sonograms, pain medicine. He usually spends quite a bit of time there. Ironically, though, sometimes I've had the worst issues because we look at women as being hysterical. We look at them as being dramatic. We look at them as being babies or whiners. And men are typically looked at as strong and stoic and more rational than women. So I think that's kind of where some of that's coming into play. I know that that happens in doctor's appointments too, where doctors won't talk to the woman, but they'll start talking to their husband and the woman's the patient. Particularly frustrating in an OBGYN setting because men do not have vaginas, so they don't even understand what's going on. The other issue that I've noticed is when you've had a lot of medical problems, you experience pain differently. I have a really high tolerance for pain, and when I'm in pain, I don't speak because I'm just trying to manage it. And I don't like crying in front of people. I don't like to look like I'm in pain, so I just kind of suck it in. And people sometimes would look at that as being depressed or anxious. If you've had medical problems, you've waited for hours in the ER, which is awful. and frustrating and draining and difficult. So we're kind of used to waiting. Add on past traumas from other doctors, minimizing or invalidating isn't helpful either. There also are limits from our insurance. We live in a world of managed care, and I totally get how we got here because there was a lot of fraudulent billing and things weren't being truthful. So managed care came in to kind of clean that up, and it did work, but it also causes things to be more difficult. It's difficult to get admitted to the hospital from the ER. Sometimes your insurance won't cover it. And so then what do? You're already admitted, you have a huge bill. And hospitals don't want to create those bills because they know if insurance doesn't pay, they're not going to get paid either. Sometimes insurances won't cover our testing either. Usually you have to jump through hoops, like to get to one specialist, maybe you have to go to PT so many times, or to get an MRI, you might have to have all these other imaging done and so much time going by. They run or they dictate the treatment that we get, unfortunately. There's always frequent ER visits, doctor visits, keep trying to find places that you can get in, and this causes frustration for not only the person and their family, but then also the practitioners, because they're frustrated. As this is going on, the doctors that aren't sure, and if they have a hypothesis that there may be some mental health going on, sometimes this confirms it because we look frustrated and upset. If we've done our own research and we've been to a lot of doctors, sometimes we don't trust anybody. And that's a problem because we're still going to doctors for their expertise. So if we don't trust them, why are we going there? It's almost like a catch-22. It's really hard to figure out. It took me a long time to understand that. You're also working against past doctors' notes. And there was a Seinfeld episode about that. I think Elaine was trying to get her chart from one of the doctors because she thought they said something about her. Well, that's exactly, I think, what happens sometimes is that, something was written down in your notes. And so like all the doctors are reading through your notes and there it is. There are also other people involved in your treatment that you may not know, not only the insurances, but if you have testing done, there could be a bias from the radiologist. One of the major networks, and I can't remember which one it was, had an article about this, or they had it on their show and then they wrote the article about it. And they talked about how when the same group of radiologists or the same radiologist sees the same person being tested over and over again, sometimes they have their own biases and they miss big things because they're so focused on, why is this person still coming here? I'm so frustrated. There's also, I think I mentioned earlier, a gap between inpatient, outpatient, ER, specialist, getting testing done. Everything has these systems and they take so long to get through sometimes. And you have sensitivities that increase. And there has some talk about that happens during the dark night of the soul when people have a spiritual awakening. I've also noticed that genetic people that, people with the same genetics, not genetic people, but people with genetics with red hair, pale skin, they have a higher disposition to inflammation based on different foods and pesticides. Ironically, that's what I have because most of my cousins have red hair and we're all pale. So thank you, genetics. So after describing all this, what can we do? I think that's an important thing to start to think about. Not only validating that, yes, this happens, but there are things that we can do. There are things that can be done to make things better. For instance, when you go to your appointments, it might be good to take like an index card or a list of your symptoms or things that have been going on so that you can focus when you're in there and specifically tell the doctor instead of getting pulled off thinking about something else or maybe being anxious or having some PTSD reaction. It also helps to take somebody with you. And I try to take the same person so that they can, validate things from doctor to doctor to doctor, what's been happening and what's been said. And sometimes, honestly, I'm so in a whirl, it's hard to absorb all the information. So having two set of ears is better than one. It also helps to be firm, to be polite, and you need to be open to what the doctor is saying and telling you to do. Sometimes they really do want to help us and they have to do some things to rule some things out. And if we're not open, that can't happen. You also need to set boundaries if you feel you're disrespected. I hate to say this, but as a woman, if you don't respect me as a woman and you start to treat me stereotypical, like I'm hysterical or I'm stupid or whatever, I get very angry very quickly. And what I've tried to do is bring that temper down and just very assertively ask them if we can move forward from this or I need to leave. And I think that that's appropriate. I think it's appropriate to give people a chance. Also, trying to help calm yourself before an appointment is very, very, very helpful. If the insurance won't cover things, there's a couple of options. One, ask your doctor. Sometimes they don't do things and it's like they're thinking, but they're not verbalizing everything they're thinking. So if you have inkling that maybe something isn't covered and that's why the doctor's not doing it, just ask them. Sometimes I've been told that that's what it is, and then I've asked them, or I've had people say, well, okay, so what have you done in the past? What has worked? You can also call the insurance and talk to them yourself, which is kind of cool. Maybe it's worth risking them not paying for it and going into debt. My health is priceless. I really try to get my insurance to cover things, but I think I'd rather be alive. If you are going through this, keep looking for somebody who will listen. Stick to your personal truth. Just because other people tell you something isn't true or is not happening doesn't mean that that's not true for you. I do believe that we know when things resonate with us if we're honest and we're listening. So keep looking for a doctor that'll listen, even if you have to travel. Sometimes that's okay. It's not doctor shopping unless you're seeking for medications or you're seeking for a specific diagnosis. Then that's probably not good. You can go to different specialists in different areas. Where I live, we have two main cities close to us. One's in another state. I'll go there. Sure. Maybe there's a teaching hospital nearby, and those are kind of cool. We'll also have to remember that doctors are people too, and people make mistakes. We all put our pants on with 1 foot at a time. Not everybody graduates at the top of their class. Some people have book knowledge, but they can't put it into practical use. They're just people. So we have to find the ones that work for us. I've also had to choose between bedside manner and knowledge. Sometimes doctors are a little rough around the edges and I don't really appreciate some of the things they say, but they're smart and they help me and I get better. So I think I'm going to choose the get better and I'll deal with the rest. Always go to the ER if you need to. Like if you have chest pains or a head injury, or you're in a car accident, if you're bleeding, if you think you have a broken bone, if you have an allergic reaction, don't listen to people that tell you not to go to the ER. That's dumb. I would far rather go to the ER because I thought I was having a heart attack and end up with an anxiety attack than not go and die or have a heart attack and have damage later. So please go to the ER, especially for pain management. I think that's one of the biggest things that I try to teach people is that don't be a hero. When you're in pain, your blood pressure goes up. It's hard on your heart. It's hard on all of your organs in your body. And it drains you. It's really hard to get better when you're exhausted. I always try to give doctors and PAs and specialists a second chance, even if it starts off bad. I would like to show them who I am. You can stereotype me, whoever you want, but that is not who I am, and I will prove that to you. Also, don't be afraid to ask for your needs. Tell them what you need when you go to your appointment, to the ER, to wherever. If you ever have problems with IVs, like in the ER, in your office, or when you're getting a procedure or surgery done, you can ask for smaller needles, especially for women, because we have tiny veins, and we have veins that roll and disappear and do all kind of fun things. Or you can ask for a phlebotomist, because that's what they do all the time. They're amazing. We have one person we call the mosquito. So you should ask for a mosquito. You can also see another doctor, get a second opinion, even if you're in the ER. And always I want to try and keep my integrity, because just because somebody else is acting a fool does not mean that I am. And again, that's where the assertiveness is, setting boundaries and knowing when to walk away comes into play. Of course, I'm a therapist, and I agree you should seek therapy. And I'll say I did that too, and it really helped me. It helps to recognize the trauma, the anxiety, and the fears that you're facing. You can learn to be calmer and let go of expectations. That helps. You can work on pain management. You also have a mental health evaluation, so if there's any questions, you already have it. Maybe even having a letter from your therapist put in your medical chart is helpful. They can submit that to your PCP. You can also contact people to complain to voice your opinions to hopefully make this better for yourself later or somebody else. And you can contact a hospital advocacy or hospital patient advocacy person. You can contact the head of a department. You can talk to the hospital board or administration. All doctors have a medical license board that they answer to, nurses as well. You can submit your information on reviews online. Tell your friends, your family, put it on social media. NAMI has a local chapter in every state. NAMI is a National Alliance for Mental Health. They advocate for people, so that could be an option as well. I have had some people discuss their issues with a lawyer because they feel that they have a good case. And I would keep talking to other people and see their experiences too, because it really helps to know that you're not the only one that this is happening to. And by the way, you don't want to just talk about the bad things that happen, but you also want to let people know when you've had a good experience. Sometimes that's the best way to find good practitioners, is by word of mouth, or somebody who had problems that couldn't be solved and this doctor did it. So I want to go to them. So I hope that helps. I hope it helps you feel like you're not the only person and kind of gives you some perspective. Thanks a bunch and have a good week.